Hi everyone, I hope you're having a great week. I'm Katharina Kang, Mission Programs Manager at Komen, North Texas, and I'm excited to be back with you again for our monthly educational series. If you missed last month's episode about breast cancer clinical trials, be sure to check it out on our Facebook page or our YouTube channel. Just search for Komen, North Texas. There you can find all of our breast health educational videos. Today we're talking about treatment. This is a conversation that could literally take us days, so we're going to tackle this topic very broadly by defining a few terms and going over a few common therapies. Before we begin, we want to stress that because breast cancer presents itself differently in everyone, each person's treatment plan is extremely personal and can be vastly different from person to person. What works for one person may not work for another. Your personal breast cancer treatment plan will be based on several factors, including the biology of your tumor, the stage of breast cancer, your overall health, age, and medical history, and your personal preferences. You should feel empowered to talk with your doctor and make a plan if you are diagnosed with breast cancer. Maybe even bring a friend or a family member with you to appointments to help keep any questions or thoughts organized. On Komen.org, we even have some great tools with suggested questions to ask your doctor so that you can gather all the information you need when you speak with them. If you or a loved one is diagnosed with breast cancer, take all the time you can to learn about your breast cancer and treatment options. Don't feel rushed to make important decisions. And furthermore, don't let anyone pressure you into making a decision before you're ready. And don't be afraid to get a second opinion. If you feel that your doctor isn't answering your questions or taking the time to talk through all of your options, you are under no obligation to continue to see them. Find a doctor who will be honest and direct with you while also taking the time to consider your thoughts and opinions about your own treatment. Now, let's talk about some of the types of breast cancer treatment that you may consider if you're diagnosed with breast cancer. First, breast cancer treatment can be divided into two major categories: local therapy and systemic therapy. Local therapy removes the cancer from a limited or local area, such as the breast, chest wall, or lymph nodes in the underarm area. Typically, this involves surgery, with or without radiation therapy, to the breast area. Systemic therapy aims to get rid of cancer cells that may have spread from the breast to other parts of the body. It includes chemotherapy, hormone therapy, and targeted therapy. Because systemic therapy is used in addition to or an adjunct to breast surgery, these treatments are often called adjuvant therapy. Now, let's dive a little deeper to the specific types of local and systemic treatments. And as we have said at the beginning of the video, each person's treatment plan will be different based on what that person and their doctor decide. These are just general descriptions of treatment types. Let's start with the first category, local therapies. Surgery. Common surgery done to treat breast cancer can be a lumpectomy or mastectomy. A lumpectomy removes the tumor and some normal tissue around it. The general shape of the breast and nipple area are preserved. Sometimes this is also called breast conserving surgery. Mastectomy removes the entire breast. A double mastectomy is the removal of both breasts. In many cases, but not all, this includes the removal of the nipple and areola. Some women choose to have reconstructive surgery after a mastectomy to restore the look of the breasts or breasts that were removed. Reconstruction can be done during the mastectomy surgery, at a later date, or not at all. That's completely up to the patient. Talk to your doctor about what you want and what your options are. Radiation. Radiation therapy uses high-energy X-rays to kill cancer cells that may be left after surgery. Radiation is almost always given after a lumpectomy and sometimes after mastectomy. Now, here are some examples of systemic therapies. Chemotherapy. Chemotherapy uses drugs to kill cancer cells throughout the body. It is often given in cycles over 3 to 6 months, with days or weeks off between treatments. The schedule depends on the combination of drugs. Hormone therapy. Hormone therapy drugs slow or stop the growth of hormone receptor positive tumors by preventing the cancer cells from getting the hormones they need to grow. Drugs like tamoxifen and aromatase inhibitors fall in this category. Targeted therapy. Targeted therapy drugs kill cancer cells with certain markers or proteins. For example, trastuzumab or Herceptin treats HER2 positive breast cancer. It's worth noting that each of the types of treatments we just discussed have side effects, some potentially life-changing, which makes it all the more important to be involved in your own treatment decision-making. If you or someone you know is facing metastatic breast cancer, your treatment plan may be a little different, but there are still options. Although metastatic breast cancer is not currently considered curable, it is treatable. Today, some women live many years with metastatic breast cancer as a long-term chronic condition. And as treatment for both early stage and metastatic breast cancer continues to improve, so does survival. A treatment plan for metastatic breast cancer would be developed based on the unique characteristics of your breast cancer. Typically, someone living with metastatic breast cancer is also monitored every few months to see if the cancer is responding to treatment. I know I mentioned it at the beginning of the video, but I wanted again to do a quick shout out for our last Facebook Live video on clinical trials. No matter your stage of diagnosis or treatment plan, you may be eligible for a clinical trial. This offers you a chance to try a new breast cancer treatment and possibly benefit from it. You could also help others someday by supporting research. Check out the video for more information and talk to your doctor to learn if a clinical trial could be a good fit for your treatment plan. Finally, no matter what your breast cancer treatment plan involves, it's vital that you complete it. People who complete their treatment plan have a higher chance of survival than those who don't. This is why it's important to follow through on your medications and other therapies prescribed by your doctor. And don't let the side effects stop you. Tell your doctor right away if you're experiencing side effects, and he or she may be able to either treat the symptoms or alter your treatment plan to ease the symptoms. Don't let insurance or financial issues stop you either. We at Komen know that sometimes paying for medications and other out-of-pocket expenses can also be a burden. Not to mention the time it takes to go to appointments, the transportation to and from, the cost of childcare. It can really be overwhelming. If you need help with any of these things, Komen is here to help. Please reach out to our affiliate or call the Komen Breast Care Helpline at 1-877-GO-KOMEN. There are programs out there that can help, and we'd be happy to put you in touch. Even if we don't currently fund the specific programs or services that you need, we have a vast network of healthcare providers that can give you the support you do need. That's it for today. Thanks again for joining us for our monthly educational series, and let us know in the comments below if you have any questions about breast cancer treatment. Talk to you again next month.